Occupational English Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12. You hear a doctor talking to a new patient. For questions 1 to 12, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Good morning. How can I help you today?
I'm here because I've been experiencing a lot of pain and rash on my skin.
I see. Can you please tell me your name and age?
My name is Jane, and I'm 45 years old.
Okay, Jane. Can you describe the timeline of your symptoms and how they have progressed?
Sure, it started with a tingling sensation on my skin a few days ago. Then, a rash developed and now it's very painful.
I see. Do you have any past medical history?
Yes, I had chickenpox as a child.
Thank you for letting me know. What about your family history? Do you have any relatives with illnesses?
My mother has a history of high blood pressure and my father had a history of diabetes.
Noted. Do you have any allergies?
I'm allergic to penicillin.
Thank you for sharing that information. Now, let me perform a physical examination. I will need to take your vital signs. Your blood pressure is 130/80, your heart rate is 90 beats per minute, and your respiratory rate is 18 breaths per minute.
Okay, thank you.
Based on your symptoms and physical examination, I suspect that you may have shingles. I will need to run some tests to confirm the diagnosis, such as a viral culture or blood test.
Okay.
As for nursing management, we will need to provide pain management and closely monitor your symptoms. Treatments may include medications such as antiviral drugs and pain relievers. I will give you the doses to take.
All right.
Your discharge plan will depend on the severity of your symptoms and the effectiveness of treatment. I will schedule a follow-up appointment to assess your progress and adjust your treatment plan as necessary.
Thank you, doctor.
You're welcome, Jane. Let's talk a bit more about your symptoms. You mentioned that the rash is painful. Can you describe the type of pain you're experiencing?
It's a burning and throbbing sensation, and it's worse when anything touches the affected area.
I see. Have you been experiencing any fever or chills?
No, I haven't had a fever or chills.
Okay, that's good to know. In terms of your daily routine, has the pain and rash been affecting your ability to work or perform daily activities?
Yes, it's been difficult to work and even sleep due to the discomfort.
I understand. In addition to medication, there are some home remedies that may help alleviate your symptoms, such as cool compresses and calamine lotion. I'll make sure to provide you with some information on that.
Thank you, that would be helpful.
Also, since shingles is a contagious viral infection, it's important to avoid contact with individuals who have not had chickenpox or the chickenpox vaccine. It's important to keep the affected area clean and covered to prevent spreading the virus.
Understood.
Lastly, it's important to monitor for any complications, such as secondary bacterial infections or nerve damage. If you experience any new symptoms or your symptoms worsen, please do not hesitate to contact me.
I will definitely keep that in mind. Thank you again, Doctor.
You're welcome, Jane. It was a pleasure to assist you. Remember to take your medication as directed and follow up with me in a week's time.
Now, look at the notes for extract 2. Extract 2. Questions 13 to 24. You hear a consultation in GP's office. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
Hello, good afternoon. May I have your name, please?
Hi, my name is Emily.
Hi Emily, can you please tell me your age?
I'm 28 years old.
What brought you to the hospital today, Emily?
I've been experiencing chest pain and shortness of breath for the past few weeks. It's been getting worse and it's difficult for me to do any physical activity.
Okay, thank you for letting me know. Before we proceed, can you tell me a little bit about your past medical history?
Yes, I have a history of hypertrophic cardiomyopathy.
Thank you. And, do you have any family history of illness?
Yes, my mother has high blood pressure and my maternal grandfather had a heart attack.
All right, thank you for sharing that. Now, can you please tell me about your social history? Do you smoke or consume alcohol?
I don't smoke or consume alcohol.
Good to know. Do you have any allergies?
No, I don't have any allergies.
Thank you for the information, Emily. Now, can you describe your symptoms to me in detail and give me a timeline of how they have progressed?
I started feeling chest pain about 3 weeks ago. It was mild at first, but then it started getting worse and now it's constant. I also have shortness of breath and feel tired all the time. It's been difficult for me to do any physical activity.
I see. Thank you for the detailed information, Emily. I will now proceed with a physical examination to check your vital signs. Your blood pressure is 130/90 mmHg, your heart rate is 100 beats per minute, and your oxygen saturation level is 95%. These are all within the normal range but may be relevant to your condition. Based on your symptoms and physical examination, I suspect that you may be having a hypertrophic cardiomyopathy episode. I will need to order some investigations such as an echocardiogram and a stress test to confirm the diagnosis. In the meantime, I will prescribe some medication to manage your symptoms and help improve your heart function. You will need to avoid physical activity until further notice. As for your discharge plan, you will need to come back for a follow-up appointment in a week. If there is no improvement, we may need to consider a hospital admission for further treatment. During your stay, we will provide nursing care to ensure that you are comfortable and well taken care of. You will need to follow a strict medication regimen and avoid exposure to anything that could worsen your condition.
Thank you, Doctor. I have a few questions before we move forward. Can you please explain to me what hypertrophic cardiomyopathy is and what causes it?
Of course, Emily. Hypertrophic cardiomyopathy is a condition where the heart muscle becomes thickened and stiff. This makes it harder for the heart to pump blood to the rest of the body. It can be caused by a genetic mutation or it may develop spontaneously without a clear cause.
Is it a serious condition, Doctor?
It can be serious, especially if it is not diagnosed and treated early. If left untreated, it can lead to heart failure, arrhythmias, and sudden cardiac death. However, with proper treatment and management, most people with hypertrophic cardiomyopathy can lead normal lives.
Okay, thank you for explaining that to me. Can you also tell me more about the medications you are going to prescribe and their possible side effects?
Sure, Emily. I am going to prescribe beta blockers and calcium channel blockers to help manage your symptoms and improve your heart function. These medications work by slowing down the heart rate and reducing the force of the heart's contractions. The most common side effects of these medications include fatigue, dizziness, and low blood pressure. However, if you experience any other unusual symptoms, you should let me know right away.
Okay, I understand. What about the tests that you are going to order, doctor? What will they tell us?
The echocardiogram is a test that uses sound waves to create images of your heart. It will help us determine the thickness of your heart muscle and identify any abnormalities in your heart's structure and function. The stress test is a test that measures how your heart responds to physical activity. You will be asked to walk on a treadmill or ride a stationary bike while we monitor your heart rate, blood pressure, and other vital signs. These tests will help us confirm the diagnosis of hypertrophic cardiomyopathy and determine the best course of treatment for you.
Thank you for explaining that, doctor. Is there anything else I should be aware of or do while I wait for my follow-up appointment?
Yes, Emily. You should avoid physical activity and anything that could increase your heart rate or put stress on your heart. You should also avoid smoking and drinking alcohol, as they can worsen your condition. Make sure to take your medications as prescribed and let me know if you experience any unusual symptoms. It's important to come back for your follow-up appointment so that we can monitor your progress and adjust your treatment plan if necessary.
Okay, I will keep that in mind, doctor. Thank you for your help and guidance.
That is the end of part A. Now look at part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. You hear part of a conversation between a doctor talking to a patient. Now read the question.
Good morning, Mr. Smith. I see from your records that you've been experiencing high blood pressure. How long have you been dealing with this issue?
Hello. Yes, my blood pressure has been high for a few months now, and I'm concerned about the implications it could have on my health.
I understand. High blood pressure, also known as hypertension, can lead to a range of health problems. Can you tell me about your lifestyle habits, such as your diet and exercise routine?
I don't exercise as much as I should, and I know I could eat healthier. I do have a tendency to consume a lot of salty foods, which I've heard can contribute to high blood pressure.
Yes, a high-salt diet can certainly be a contributing factor. It's important to make changes to your lifestyle habits to help manage your blood pressure. Have you considered working with a nutritionist or a personal trainer to develop a plan?
I haven't thought about it, but I'm open to suggestions.
I can refer you to a nutritionist or a personal trainer who can work with you to develop a plan that suits your needs and lifestyle. In the meantime, it's important to reduce your salt intake and increase your physical activity.
That sounds like a good plan. What about medications? Do I need to take medication to manage my blood pressure?
Now look at question 26. You will hear a part of a speech given by a healthcare professional. Now read the question.
Good day everyone. As an optometrist, I am here to talk to you about the importance of regular eye exams for maintaining eye health. Many people often underestimate the value of taking care of their eyes until something goes wrong. However, just like any other part of our body, Our eyes require proper care and attention to ensure that they function properly throughout our lives. Firstly, regular eye exams are essential for detecting any early signs of eye diseases or conditions such as glaucoma, cataracts, and macular degeneration, which can lead to blindness if left untreated. In fact, many of these conditions do not present any symptoms until they have progressed to an advanced stage, making early detection crucial for effective treatment. Secondly, regular eye exams can also detect other health conditions beyond the eyes. The eyes can provide valuable insight into our overall health, and an optometrist may be the first to detect certain health conditions such as diabetes, hypertension, and high cholesterol during an eye exam.
Now look at question 27. You hear part of a conversation between a nurse and a patient. Now read the question.
Yes, maintaining a healthy lifestyle with a balanced diet, regular exercise, and getting enough rest can help boost your immune system and reduce the frequency of outbreaks. Stress can also trigger outbreaks, so finding healthy ways to manage stress, such as meditation or exercise, can be helpful.
That makes sense. How often should I take the antiviral medication and for how long?
The dosage and duration of antiviral medication will depend on the severity of your symptoms and how often you experience outbreaks. It's important to follow the instructions on the prescription and take the medication as prescribed. Some people may need to take medication every day to prevent outbreaks, while others may only need to take it during an active outbreak.
Okay, I'll make sure to follow the instructions carefully. Is there anything else I should know about managing my herpes?
It's important to communicate with your sexual partners about your herpes status and to use condoms consistently and correctly. You may also want to avoid sexual contact during an outbreak or when you feel symptoms starting to appear. It's also important to practice good hygiene by washing your hands and avoiding touching your sores to prevent spreading the virus to other parts of your body or to others.
Thank you for all the information and advice. I will make sure to take good care of myself and manage my herpes as best as I can.
You're welcome. Don't hesitate to contact me if you have any further questions or concerns.
Now look at question 29. You will hear a part of a speech given by a healthcare professional. Now read the question.
Good morning everyone. I am honored to be standing here today to talk to you about the role of radiography in diagnostic imaging. Radiography is a branch of medical imaging that uses X-rays to create images of the inside of the body. It is a non-invasive procedure that can help diagnose and monitor various medical conditions. Radiography is used to investigate different parts of the body such as the chest, abdomen, pelvis, bones, and joints. One of the primary roles of radiography is to help diagnose and manage injuries and diseases. Radiographers work in collaboration with radiologists and other healthcare professionals to interpret and report on images produced by the radiography equipment. This partnership helps to ensure that patients receive the best possible care and that healthcare providers are able to make accurate diagnoses.
Now look at question 29. You hear part of a conversation between a GP and a patient. Now read the question.
Are there any side effects to the treatment options?
Some medications can have side effects, but we will monitor you closely to ensure that any side effects are managed effectively. It's important to follow the treatment plan closely to improve your quality of life and prevent complications.
Thank you. I'm willing to do whatever it takes to manage my symptoms and improve my health.
That's great to hear, Ms. Thompson. Let's talk a bit more about your symptoms. Can you describe the abdominal pain you've been experiencing? Is it a sharp pain, a dull ache, or a crampy feeling?
It's mostly a crampy feeling. It feels like my stomach is tied up in knots.
I see. That's a common symptom of irritable bowel syndrome. Have you noticed any changes in the consistency of your bowel movements, such as diarrhea or constipation?
Yes. My bowel movements have been quite irregular lately. Sometimes I'll have diarrhea, and other times I'll be constipated for days.
Now look at question 30. You hear a part of a conversation between a healthcare professional and a client. Now read the question.
Hi there. How can I help you today?
I've been experiencing some tooth pain lately, and I think I might have a cavity.
Okay. Let's take a look. Yes, you do have a cavity there.
How did I get a cavity?
Cavities are caused by bacteria that produce acid within the mouth. This acid eats away at the enamel on your teeth, eventually causing a hole or cavity to form.
How can I prevent cavities in the future?
There are a few things you can do to reduce your risk of developing cavities. First, make sure you're brushing your teeth at least twice a day with a fluoride toothpaste. You should also floss daily to remove any food particles and bacteria from between your teeth.
What about my diet?
Yes, diet plays a big role as well. Try to avoid sugary and starchy foods and drinks, like candy and soda, which can contribute to the growth of bacteria in your mouth.
Are there any other preventive measures I can take?
Absolutely. We can apply dental sealants to your teeth, which act as a barrier to protect them from decay. We can also give you fluoride treatments, which strengthen your enamel and make it more resistant to acid erosion.
That sounds great. Thank you for your advice.
You're welcome. Remember, good oral hygiene and a healthy diet are key to preventing cavities and maintaining good oral health.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B or C which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You hear an interview with a doctor. You now have 90 seconds to read questions 31 to 36.
Today, we are talking to Dr. Andrew Lee, a nephrologist and expert in acute kidney injury in the USA. Dr. Lee, can you explain what acute kidney injury is and what causes it?
Acute kidney injury is a sudden loss of kidney function that occurs within a few hours or days. It can be caused by a number of factors, including decreased blood flow to the kidneys, damage to the kidneys themselves, or blockages in the urinary tract. Common causes include dehydration, infection, medication toxicity, and conditions like heart failure or liver disease.
How is acute kidney injury diagnosed and what are the symptoms?
Symptoms of acute kidney injury can vary depending on the cause and severity, but may include decreased urine output, fluid retention, nausea, vomiting, fatigue, and confusion. Diagnosis is typically made through blood and urine tests, which can evaluate kidney function and the presence of any underlying conditions.
What treatments are available for acute kidney injury?
Treatment for acute kidney injury depends on the underlying cause and severity. In some cases, simply addressing the underlying condition or removing the offending medication can help improve kidney function. Other treatments may include intravenous fluids, medications to manage blood pressure or electrolyte imbalances, or even dialysis in severe cases.
Are there any long-term complications associated with acute kidney injury?
In some cases, acute kidney injury can lead to chronic kidney disease, which is a long-term condition that can eventually progress to kidney failure. This risk is higher in individuals who have pre-existing kidney disease, diabetes, or high blood pressure.
What can people do to prevent acute kidney injury?
The best way to prevent acute kidney injury is to maintain a healthy lifestyle and manage any underlying medical conditions, like high blood pressure or diabetes. Avoiding medications that can harm the kidneys, staying hydrated, and seeking prompt treatment for infections or other illnesses can also help reduce the risk of developing acute kidney injury.
Can you share a case study of someone who has experienced acute kidney injury?
Yes, I recently saw a patient, let's call her Mary, who presented with severe dehydration and fatigue. After running some tests, we discovered that she had developed acute kidney injury due to dehydration. We immediately started her on intravenous fluids and monitored her kidney function closely. Within a few days, her kidney function had improved and she was able to return home with instructions to stay well hydrated and avoid dehydration in the future.
What advice do you have for individuals who may be at risk for acute kidney injury?
If you are at risk for acute kidney injury, it's important to be proactive in managing your health and seeking prompt treatment for any illnesses or conditions that can harm your kidneys. Staying hydrated, avoiding medications that can harm the kidneys, and maintaining a healthy lifestyle can also help reduce your risk. If you experience any symptoms of acute kidney injury, like decreased urine output or fluid retention, it's important to seek medical attention immediately.
Thank you, Dr. Lee. Can you elaborate on some of the underlying medical conditions that can lead to acute kidney injury?
Certainly. High blood pressure, diabetes, and heart failure are some of the most common medical conditions that can lead to acute kidney injury. In these conditions, the kidneys may not receive enough blood flow to function properly, or the underlying disease process may directly damage the kidneys.
You mentioned earlier that dehydration can be a cause of acute kidney injury. How much water should people be drinking to avoid dehydration?
The amount of water someone needs can vary based on factors like age, weight, and activity level, but a general rule of thumb is to drink at least 8 cups, 64 ounces, of water per day. People who are more active or live in warmer climates may need to drink more to stay hydrated.
Are there any medications that people should be cautious about taking to avoid acute kidney injury?
Yes, certain medications can be harmful to the kidneys, particularly when taken in high doses or over a long period of time. Nonsteroidal anti-inflammatory drugs, NSAIDs, like ibuprofen and naproxen, for example, can cause kidney damage when taken in excess. People with pre-existing kidney disease should be particularly cautious about taking medications that can harm the kidneys and should always consult with their doctor before starting any new medications.
Can you explain how dialysis works and when it may be necessary for someone with acute kidney injury?
Dialysis is a treatment that uses a machine to filter waste products and excess fluid from the blood when the kidneys are unable to do so on their own. It may be necessary for someone with acute kidney injury if their kidney function has severely declined and they are experiencing complications like fluid overload or high potassium levels. Dialysis can be temporary or long-term, depending on the underlying cause of the kidney injury and the patient's overall health.
Are there any dietary recommendations for people with acute kidney injury?
Yes, people with acute kidney injury may need to follow a low-sodium and low-potassium diet to help manage their symptoms and prevent complications. A dietitian can work with the patient to develop a personalized meal plan that meets their nutritional needs while also addressing their kidney function.
Finally, can you discuss any ongoing research or advancements in the treatment of acute kidney injury?
There is ongoing research in the development of new medications and treatments for acute kidney injury, including stem cell therapy and new drugs that can help protect the kidneys from injury. In addition, there is a growing emphasis on early detection and intervention for acute kidney injury to help prevent progression to chronic kidney disease.
Now look at extract 2. Extract 2. Questions 37 to 42. You hear a talk given by a healthcare professional. You now have 90 seconds to read questions 37 to 42.
Ladies and gentlemen, esteemed colleagues and fellow medical professionals, I would like to talk to you today about hereditary hemochromatosis. Hereditary hemochromatosis, also known as HFE-related hemochromatosis, is an inherited disorder that causes the body to absorb too much iron from the diet. Iron is essential for survival, as it helps to create hemoglobin in the red blood cells, which carries oxygen to the rest of the body. However, too much iron can be toxic and cause a number of serious health problems. Hereditary hemochromatosis is caused by mutations in the HFE gene. This gene provides instructions for making a protein that helps to regulate the absorption of iron from the diet. When the HFE gene is mutated, the body absorbs too much iron, leading to iron overload in the body's tissues and organs. Symptoms of hereditary hemochromatosis can include fatigue, joint pain, abdominal pain, liver enlargement, and diabetes. These symptoms may not appear until a person is in their 40s or 50s, although some people may experience symptoms earlier in life. Diagnosis of hereditary hemochromatosis is typically made through a combination of medical and family history, physical examination, and laboratory tests. Blood tests can evaluate iron levels in the blood, as well as measure the amount of iron stored in the body's tissues. Genetic testing can also be useful in confirming a diagnosis. Treatment for hereditary hemochromatosis typically involves phlebotomy, or blood removal. This process involves regularly removing a small amount of blood from the body, which helps to lower iron levels. In some cases, this may be done as often as once a week. Over time, this can help to reduce iron levels and alleviate symptoms. It is important to note that hereditary hemochromatosis is a serious condition that can lead to a number of complications if left untreated. These can include liver damage, diabetes, heart disease, and cancer. Therefore, early diagnosis and treatment are critical for managing the condition and reducing the risk of these complications. For those with hereditary hemochromatosis, diet can also play a key role in managing the condition. Foods that are high in iron, such as red meat and organ meats, should be limited or avoided. Vitamin C supplements should also be avoided, as they can enhance iron absorption. In addition, it is important for individuals with hereditary hemochromatosis to seek genetic counseling if they are planning to have children. This can help to identify potential carriers of the condition and allow them to make informed decisions about their family planning options. To illustrate the key points, I would like to share with you a case study of a patient with hereditary hemochromatosis. John, a 45-year-old man, initially presented with joint pain and fatigue. His symptoms worsened over time, and he also developed abdominal pain and an enlarged liver. Blood tests revealed high iron levels and genetic testing confirmed a diagnosis of hereditary hemochromatosis. John received regular phlebotomy treatment, which reduced his symptoms and improved his quality of life. He also made changes to his diet, reducing his intake of red meat and organ meats, and increasing his consumption of foods high in calcium, which can inhibit iron absorption. Despite treatment, John still experienced complications related to his condition. He developed type 2 diabetes and was diagnosed with non-alcoholic fatty liver disease. However, with ongoing management, his symptoms were controlled and he was able to live a relatively normal life. He sought genetic counseling and learned that he was a carrier of the condition, which helped to inform his family planning decisions. Current research in the field of hereditary hemochromatosis is focused on developing new treatments and improving diagnostic techniques. Studies are underway to investigate the use of medications to remove iron from the body, as an alternative to phlebotomy. Genetic testing is also being developed to identify individuals at risk of hereditary hemochromatosis before symptoms appear, which could allow for earlier intervention and prevention of complications. In conclusion, hereditary hemochromatosis is a complex condition that requires early diagnosis and ongoing management to prevent serious complications. Patients with hereditary hemochromatosis can lead normal lives with the right treatment, diet, and care. Researchers are working to improve our understanding of the condition and develop new treatments, which will ultimately benefit patients and their families. Thank you.
That is the end of part C. You now have 2 minutes to check your answers.